guys, welcome back to Medical Coding with Blue. Today's episode is all about tips for preparing for the CCS or the Certified Coding Specialist exam. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so lots of questions coming in about the CCS. The CCS is the gold standard of medical coding credentials because it says that you have mastered inpatient and outpatient coding. And it is the only one in this industry that says so. There is a CCA that covers both inpatient and outpatient, but this says that you are entry level. And there's nothing wrong with it because I had it for 13 years. Stubbornly held on to it. But another episode for another time. This is about the CCS. If you are preparing for this exam, whether you have experience, whether you have no experience, it can be daunting, right? Because a lot of people say that this is really difficult. It is a really difficult exam. I mean, I'm not going to lie because it's the mastery, and it's the mastery for a reason. It is a 4-hour exam, okay? 4 hours broken up into 2 parts. There's a multiple choice, and then there's your case studies. And today I'm going to talk about some ways to prepare yourself, and let's look at the domains, right? So the domains are the topics that are covered on this particular exam. Now, I've been getting the questions of what kind of program do you recommend to prepare? You know, I've completed my program. Now I'm going to sit for this exam, and I want to know if you recommend any programs or anything like that. I have told you guys several times before, and I've said it many, many times in the other videos as well. I don't recommend particular programs because, first of all, I haven't been through those programs, like these other prep programs and things like that. I haven't been through those. And so because of that, I'm not going to ever recommend something that I hadn't done myself, okay? Because I'm not here to try to sell you guys these things. I'm here to make sure that y'all understand that this is something that you can absolutely do on your own and prepare yourself. You don't have to continuously spend all of this money in order to be able to get a really good chance of, you know, taking and passing this exam, all right? People without experience pass this exam all the time. And I've been getting a lot of comments too that people have passed because they followed my advice. So being that I've been in this industry for 16 years, I know a thing or two, okay? And having this credential myself, I have the CCS and the CCSP. Having both of these credentials, I know a thing or two. You know, I've had all 3 credentials for medical coding that AHIMA does offer, which is the CCA. And once I got my CCSP, which is the credential that I got after I got the CCA was superseded by that CCSP. Then I got the CCS after I got my CCSP. So with that said, I'm going to talk through the domains and help you guys to think about this, okay? I'm going to read from the AHIMA website. So this exam has been facelifted before, all right? So they changed it, all right? Because they were in the beta period. Now they're out of the beta period, okay? When they say beta period, it just means that they have to have a certain number of people. It's a new exam, so they have to have a certain number of people take the exam. And then once that number has been met or exceeded, they'll go ahead and release a scoring because that's what they do. But they're already out of that. So if you take your exam, your CCS exam, the immediate scoring is available. So once you get out of your test room, they will give you your results. You know, it could be like the longest couple of minutes of your life, but they will give you your results. So to read the description of the CCS, coding specialists are skilled in classifying medical data from patient records, often in a hospital setting, but also in a variety of other healthcare settings. One of the misconceptions, before I get into the rest of this, one of the misconceptions about this credential is that it's only for inpatient. If you hear somebody say that, they're ignorant because clearly it covers both. It covers both inpatient and outpatient. So it's not just for inpatient. It says that you have the capability to be able to code inpatient, but it doesn't necessarily mean that this is the only thing that CCSs can do. I have the CCS, and I code for the outpatient setting. I'm just saying. The CCS credential demonstrates a practitioner's tested skills in data quality and accuracy, as well as the mastery of coding proficiency. The CCS certification is a natural progression for professionals experienced in coding inpatient and outpatient records. Coding specialists create coded data used by hospitals and medical providers to obtain reimbursement from insurance companies or government programs such as Medicare and Medicaid. Researchers and public health officials also use this data to monitor patterns and explore new interventions. CCSs review patient records and assign numeric codes for each diagnosis and procedure, possesses expertise in ICD-10-CM, ICD-10-PCS, and CPT coding systems, are versed in medical terminology, disease processes, and pharma concepts. And then eligibility requirements. Everybody, there's so many people who miss this, guys. Listen, you do not have to have any of these things. It's just recommended. Recommended means you do not have to have it, but they do recommend it because it's just better, because then you'll really fully understand, okay? So here we go. While not required, because so many people miss this part and they tell me, well, bro, I can't take the CCS because it requires experience. No, it doesn't. No, it doesn't. So while not required, one of the following are recommended to sit for the CCS exam. Complete courses in all of the following topics: anatomy, physiology, pathophysiology, pharma, medical terminology, reimbursement methodology, intermediate/advanced ICD, diagnostic coding and procedural coding, and medical services, CPT, HCPCS, plus 1 year of coding experience directly applying codes, or minimum of 2 years of related coding experience directly applying codes, or hold the CCA credential plus 1 year of coding experience directly applying codes, or hold a coding credential from another certifying organization plus 1 year of coding experience directly applying codes, or hold the CCSP, RHIT, or the RHIA credential. And then it says, getting prepared for the exam. AHIMA has developed a flexible online course that can help you for the CCS certification exam. Access the 6 brief lessons on your schedule, work through the content at your own pace, and revisit the lessons and material as often as needed. So when I looked it up to see how much it was, if you are not a member of AHIMA, the list price is $506 for this course. And it is basically, the certification exam prep, right? And it says, gain the essential knowledge that you will need to take the CCS certification exam with confidence. This prep product comes integrated with the CCS exam preparation ebook. You will now have ebook access at your fingertips directly through the course. Additionally, you will use this ebook on all devices using the Vital Source bookshelf application. The lessons cover key content you will encounter on the exam: coding knowledge and skills, coding documentation, provider queries, regulatory compliance, inpatient coding cases, outpatient coding cases. In addition, prepare for test day with insights on how you can schedule your exam, study the test taking tips, and what to expect on the day of your certification exam. And again, this costs $506. Now, it does say that there are 6 CEUs awarded with this bundle, right? This does not apply to you if you do not have your credential yet. A lot of people get sucked up into that. Oh, I'm getting all my CEUs and I haven't got my certification yet. None of those will count. None of those will count because you do not have a certification yet. Once you get your certification, everything you earned on that counts. But anything you earn prior to being certified does not count. Okay, just putting that out there. So just so you guys know, don't get excited when you see that you get 6 CEUs and you can't even use them. I'm just saying. So, but that's that. So they have that put together for you. You don't, well, I mean, You can, if you want to, get this program. However, if you're following the workbooks that I recommend and all the things that I'm going to suggest, you will be just fine, okay? Some people need this. They want to do this because they would make them feel better. Then by all means, you go right ahead and do it, okay? But everything that I'm going to talk about, it covers the same things. So just saying, all right? So then we have apply for the exam, apply to take the exam. The non-member price is $3.99. The member price is $2.99 for this exam. And then we have exam specifications. The CCS is a timed exam. Candidates will have 4 hours to complete the exam. The total number of questions on the exam is 107. And this is something that they've changed, because before it used to be up to 140 questions, between 115 and 140 questions. Now they've completely changed that. It is now 107 questions, all right? The CCS exam is 107 questions. There are 97 scored items and 10 pre-test items, and these are sprinkled throughout the exam, so you don't know what they are. The exam consists of 2 sections, a multiple choice section and a medical scenario section, inpatient, outpatient, and emergency department, that contains multiple choice, multiple response items. The exam is given in computer-based format. AHIMA exams contain a variety of questions or item types that require you to use your knowledge, skills, and or expertise to select the best answer. Each exam includes scored questions and pretest questions randomly distributed throughout the exam. Pretest questions are not counted in the final results. The passing score for the CCS is a 300. Competencies for the CCS fall into 4 domains. Each domain accounts for a specific percentage of the total questions for the exam. See the exam outline for detail. The 2024 exam, again, facelift, okay? The 2024 exam content outline effective May 1st, 2024. Competencies will fall into 5 domains. And so we'll get into that here in a minute. All right, so there's nothing else I need to read here. So then we have the domains, all right? So the domains is the topics that they cover on the exam. So domain 1 is coding knowledge and skills, 39 to 41% of the exam. So this is still the bulk. Coding knowledge and skills is still the bulk of this exam. When you look at the percentages of how much, you know, this domain is weighted on this exam, you need to pay attention, okay? 39 to 41% is still the bulk of this exam. So what does that tell you automatically? That you need to pay attention to this domain right here where it says coding knowledge and skills. Everything that I'm going to say right now is that part of that 39 to 41%, right? Assign diagnosis and procedure codes based on the provider's documentation in the health record. Identify principal/first listed diagnosis and procedure based on the respective guidelines. Apply coding conventions/guidelines and regulatory guidance. Attach CPT/HCPCS modifiers to outpatient procedures. Determine appropriate sequencing of diagnosis and procedure codes based on the case scenario. Apply present on admission guidelines. Demonstrate knowledge of coding edits in CCI. Medical necessity. Demonstrate knowledge of reimbursement methodologies like DRGs and APCs. Abstract applicable data from the health record, and then identify major comorbid conditions, MCCs, and comorbid conditions, CCs. All right. Then we have domain 2, which is another heavy hitter. This is one that's 18 to 22%. This is your coding documentation. Resolve conflicting documentation in health records like admission type and laterality. Ensure all required documentation for assigning a specific code is available within the body of the health record. Verify and validate documentation within the health record. So again, that's 18 to 22% of the exam. That's the coding documentation. And I'm going to read the other one, and then we'll get into the smaller ones. So the other one that's a heavy hitter is domain 4, which is your regulatory compliance. And that is also 18 to 22%. So look at that there. So we have our coding knowledge and skill, we have our coding documentation, and then we have our reimbursement compliance, right? or regulatory compliance rather, for 18 to 22% on those last two. And then the tasks in that domain is to ensure completeness and accuracy of health records, understand payer-specific guidelines, identify patient safety indicators, PSIs, and hospital-acquired conditions, HACs, based on the provider's documentation, ensure compliance with HIPAA guidelines, and then ensure adherence to AHIMA standards of ethical coding. That is available for free on the internet as well. All you have to do is just Google that. Ensure compliance with the Uniform Hospital Discharge Data Set. And that is also the UHDDS. That is also just let your fingers do the walking, and you'll see like whole articles about the UHDDS that you can learn on, okay? And then we have our two sections that are only 9 to 11% of the exam. So what does this mean? 9 to 11% of the exam. While it is on the exam, it is not weighted as heavily because there's not that many questions or there's not that many things that go over it. So we don't know exactly how many, but 9 to 11% of this exam is going to be about provider queries. So think about that. Which ones do we need to really study and make sure that we understand? Because everything else, the provider queries, which is 9 to 11%, and the information technologies, 9 to 11%, these are going to be a natural byproduct of these other three sections that you're already studying anyway. Okay, so check this out. So for domain 3 is provider queries, 9 to 11%. Identify elements of an ethical compliant query. So we're already reviewing the ethical standards of coding, right? But we're already covering the queries. So think about that. That goes, it's all together, okay? Remember, you cannot lead the witness. That is a big thing with queries. You cannot lead the witness. It has to be written in a way that you are not leading the provider to whatever response it is that you want, okay? It has to be what the provider says. And then we have the second part of this, which is determine if a provider query is compliant, non-leading. Like I said, don't lead the witness. Contains appropriate clinical indicators. That's the thing about CDI, all right? That's the thing about CDI. Those clinical indicators is very important for that. And that's how you get to that query part, is because there has to be evidence of why are you sending this query. If you're questioning the documentation because something is not clear, what are those clinical indicators? And again, clinical indicators is very much related to CDI and everything, because that's how they end up educating their providers as well. So it's all intermingled, guys. It's all intermingled. So when I hear people get so freaked out about domains that aren't weighted as heavy, I'm like, why are you freaking out? Because everything else is already interconnected. This is just a small part that is labeled by itself. All right? Does that? Okay, so hopefully. And then analyze current documentation to identify query opportunities. And then we have domain 5, which is information technologies, the other 9 to 11% of the exam. Distinguish the various types of electronic health records. Demonstrate a basic understanding of encoding and grouper software. Exhibit an understanding of computer-assisted coding, CAC software, and its impact on coding. And then ensure compliance with high-tech guidelines. High-tech, easily Googled, easily. So again, when I get these comments from people that are freaking out about something because, I don't know about this. Why are you worried about something that is a small portion of this exam when you should be concerned about the other three? Because we have that regulatory compliance, we have the coding documentation, and we have the coding knowledge and skills that are all much more heavily weighted. And then, of course, we have the second section, which is your medical scenarios, right? So we have inpatient, which is 33.3% of those medical scenarios, outpatient 33.3%, and then emergency department 33.3%. So it's all about practicing your speed, working on your speed the entire time you are taking this test. Is going to be about your speed. okay? And still consider that it's roughly 2 minutes per question, okay? Even though the number of questions have changed, you still want to roughly have it about 2 minutes per question, because you want to be able to give yourself enough time to get to those scenarios, and you still have enough time to work through those scenarios that are the medical scenarios of the exam. All right, so you have your multiple choice, and then you have your medical scenarios. So again, having and pacing yourself is going to be really, really important. But how do you do that? You do that by practicing, looking up codes, practicing with scenarios, working through the workbooks. The workbooks that I recommend are in the description box below. And you know, guys, I know that there's a lot of creators out there, like you'll see them like on Instagram and things like that. Oh, if you want this recipe, comment recipe and I'll send you the recipe. Or if you want this product, comment product and I'll send you this. No. That's not what I do here. I'm telling you guys now, if you want to see the books that I recommend, it is in the description box below. And that, again, that goes back to learning to help yourself, learning to do your research. Click where it says to learn more, expand more, whatever, right underneath my picture. There's where it starts saying disclaimer. You click there and you'll see all the books that I recommend. All right. I've said this before, ICD-10-CM and ICD-10 PCS Coding Handbook with the Answers by Nellie Leon Chizen. That is the one book that I recommend that you use to practice on, to learn ICD-10-CM and ICD-10 PCS. It's got all of the answers. It is excellently written. I love that book. And it's got a bunch of scenarios in the back that you can practice on. You cover up the answers that are listed on one side, you work through the scenarios on the other side, and you start practicing. And then you'll see, and it'll give you the rationale and everything else. And then, of course, there is the CPC study guide. Now, before you say, well, I'm taking the CCS exam, what do you mean the CPC study guide? The CPC study guide is an excellent book that I recommend for all coders, regardless of what credential you're sitting for, because everybody uses the same CPT book. Everybody uses the same CPT book, same CPT code set, same thing. That book by the AAPC is excellently written for those type of scenarios. It is very straightforward. There's a lot of really good scenarios in there. There's some without the answers that are present, or the multiple choice rather. You can cover those up, work through the scenarios, and then find out where your weaknesses are for CPT and work through that. But it's very important that you get through those two books, because that's going to be the bulk of being able to get through these exams really quickly, because again, you will have been practicing doing the coding. And then if you have the Optum ICD-10 PCS book, then it's a spiral bound book. It's the one that you can use. I would show you, but it shows up backwards. And again, it's in the description box below. If you have that in the back of that Optum book, in the Appendix M, like in Mary, there's a whole list of 388 ICD-10 PCS procedure codes to look up. If you look at the end of that section M, you will also see that there's the answer key, and it has the rationale for some of them. And you work through that. You work through those 388 procedure codes. And trust me, if you do those three things, you will be ready for that coding part, because that will have given you enough practice where you can be like, okay, I know how to get through these books. I don't need tabs. I'm not dependent on stupid circles and things like that. I am very proficient at looking up codes, because that's what it's going to take. And then you'll have spent so much time with these books, you'll know about the appendixes. And then when you open up the CPT book, you'll know right in the front cover, there's the whole list of all the modifiers and everything. If you go into the back in Appendix A, you'll see all of the explanations of all of those. So that's really going to help you, guys. But the only way you get there is by practicing. And you do that 20 hours per week. 20 hours per week. That's what you have to do. I don't want to hear any complaining. I don't want to hear any excuses, because you want to get into this. You want to be a good medical coder. You want to be able to get out there and get paid well. That's what it's going to take. Not all this cutting corners and things like that, not knowing what to do. Oh, Blue, I'm so confused and I'm just so discouraged because you're not practicing like you should, right? 3.5 hours per day, 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes on your drive home. 1 hour practice time, take a break, and then take another hour. That's 3.5 hours you did in one day. 5 days in 5 days at 17.5 hours. And then you have 2.5 hours on a Saturday or Sunday, and you've got 20 hours. You do this consistently, oh, and trust me, by the time you get ready for your test, you will be ready for your test. Reading the coding guidelines in their entirety once per week. Again, it's going to make you a faster reader. You're going to be able to fly through these things because reading and reading speed is just like a muscle. You have to build it up because everybody starts as a slow reader. I know I did. But when you are working consistently with those long materials that you're reading, like the coding guidelines, it's going to make it much more faster because you're not trying to memorize those guidelines, but what you are trying to do is you are trying to get all of the information in because believe it or not, your brain will start to recall, wait a second, I know I saw that. Let me go to the guidelines. I know I saw it there. Oh, there it is. And there, now you're cooking with magic. You're cooking with magic because it's all going to be there. And you discipline yourself this way and you make yourself this consistent studier and the results are going to speak for themselves. I know because I've coached many people this same way and they have been successful. When you listen to guidance that is from somebody who is not trying to sell you anything, and before any of you gets fresh, what I mean is I'm not trying to sell a program. I'm not trying to sell, all these things. No, I'm not trying to do that. What I am trying to do is help you to know that this is what you got to do to be able to prepare yourself. Like I said, you do a simple Google search and you can see those free AHIMA standards of ethical coding. You can look up those articles about the UHDDS. You can look up all those ones, all those things about present on admission. And in that Nelly book, that ICD-10-CM and ICD-10-PCS coding handbook with the answers, they have a whole section on present on admission. So it literally lays everything out for you here with this domain list. So this is all the things that you have to study. And when you are serious about it, when you are consistent about it, that's when you will see those good results. Okay, so that's just what I'm saying. That's how you prepare yourself. Reading, listening to the guidelines, doing all of those things, that's going to prepare you well. If you want to get the AHIMA product where they say, oh, well, we're going to go over all these things. If you want to do that, you go right ahead. You go right ahead. But I'm just telling you, everything that I'm telling you, all these things, it's all available to you. All right. So I'm just saying, with that said, I'm going to go ahead and wrap this one up. Best of luck to you. I will say, though, that when you are preparing yourself, as long as you are not cramming and you are not, just going long hours, this will be taken by your brain a lot easier than if, you're sitting here trying to put in all this time and then right before your test, you're over there looking in the books and everything. No. These are open book tests. You will have your manuals with you when you go into the exam room. So don't try to sit here and memorize all of these things. Just practice, get your rest. The day of the exam, make sure that you eat before you go in, something light enough that you're not going to be, falling asleep, but you are going to be awake because 4 hours is really long and it goes by really fast at the same time. It's just weird. So, but anyway, with that said, I'm going to wrap this one up. Best of luck to you. And I will see y'all next time. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.